I'm David Rutlen. I'm a cardiologist. I'm the director of the Division of Cardiovascular Medicine at UAMS. Now, in terms of what to do about preventing a heart attack, is we think very, very hard in terms of what risk factors a patient may have, or a potential cardiac patient may have. And we know that the older you get, the more likely you are to develop coronary disease. Both men and women can develop coronary disease, and they develop it in about the same number, in equal numbers. It's just that women live longer than men, and they develop coronary disease usually about a decade after men develop coronary disease. So an older person is more likely to have coronary disease, more likely to have a myocardial infarct, a heart attack, and a man is more likely to have a heart attack than a woman for the same age. But women catch up. It's just that they're 10 years behind. The other thing that's important is family history. And it's really a first degree relative. So if someone's mom or dad, or their brother or sister or child had a heart attack or developed angina at an early age, that makes the patient more susceptible to develop coronary artery disease. Now, it's got to be premature coronary disease in a first degree relative. So that would be a male before the age of 55 or a female before the age of 65. In all honesty, if your grandfather or a cousin or an aunt or an uncle had premature coronary disease, that doesn't place you at that much of a risk. It really has to be a first degree relative. Well, you can't do anything about your age, you can't do anything about your gender, you can't do anything about your family history, but there are risk factors that you can do a lot about. First of all, if you're smoking, you got to stop smoking. If you're chewing tobacco, you got to stop chewing tobacco. High blood pressure is another. We know the higher the blood pressure is, the longer the blood pressure is elevated, the greater the risk there is for coronary artery disease. In addition to high blood pressure being a risk factor for coronary disease, an elevated cholesterol level also can be a risk factor. And that's very, very important to get that under control. We know that having diabetes is a risk factor for developing coronary artery disease, and it's very, very important to get your diabetes under control. Now, in general, exercise probably is beneficial. The data may not be quite as strong, but there's some data to suggest that the more exercise someone is engaging in, they're less likely to have a cardiac event. We know now people that have a normal weight probably have an enhanced lifespan, probably fewer cardiac events, although the data is a little softer with that. But clearly the right body weight is going to be very helpful in terms of both the cholesterol level and the blood pressure. In the cardiovascular area at UAMS, we can take care of everything.